Right, well, hi everyone. Thanks for joining my talk today. My name's Andrea. I'm just finishing my PhD at the University of Birmingham, and I'm going to talk to you today about our brand new paper titled Targeting Aquaporin-4 Subcellular Relocalization to Treat Central Nervous System Edema, which was released only last week. So central nervous system edema is swelling of brain or spinal cord tissue following traumatic injury, concussion, or stroke. It occurs in two forms, cytotoxic and vasogenic. Cytotoxic describes the increased uptake of water into cells, particularly astrocytes, which causes them to swell. And vasogenic edema describes the breakdown of the normally very tightly restricted blood CNS barrier, which causes water to enter the tissue parenchyma. As the brain's encased in a solid skull, it has no room to swell into, and therefore edema can cause increased intracranial or intrathecal pressure, which can be life-threatening and even lead to enhanced long-term disability. Current treatments for reducing CNS edema include surgical decompression, which involves a craniotomy or a laminectomy, which provides space for the tissue to swell into, which reduces the pressure, or osmotherapy, which involves administration of osmotically active solutions such as mannitol or hypertonic saline to facilitate the movement of edematous fluids from the intracellular or parenchymal spaces back into the blood. However, neither of these treatments appear to be that clinically effective, most likely as they're trying to accommodate for an already formed pathology, and therefore the water channel protein aquaporin-4 is predominantly expressed in astrocytes, and it controls water flow in the central nervous system. It's highly expressed in astrocyte end feet in contact with the pia mater and the periventricular pendymal surfaces of the brain, and spinal cord, where it facilitates production and flow of cerebrospinal fluid, but it's also found surrounding blood vessels throughout the central nervous system, where it controls nervous system water homeostasis by facilitating water movement across the blood-brain barrier. So my group have previously shown that aquaporin-4 can undergo rapid relocalization from intracellular pools to the plasma membrane of astrocytes in response to cell swelling induced by hypotonicity. And we suggested that this may be a good target for preventing edema. However, in spinal cord or head injury, which cause a lack of blood supply and therefore a lack of oxygen to the brain, astrocyte swelling in vivo typically occurs in response to hypoxia more so than hypotonicity. And therefore in this study, we found that hypoxia also induced both aquaporin-4 membrane relocalization, as determined by cell surface biotinylation assays, and increased astrocyte swelling as a result of increased water permeability. Furthermore, we screened a number of inhibitors to determine the molecular pathway by which hypoxia or hypotonicity alter these outcomes. And the mechanism appears to involve an influx of calcium through TRPV4 receptors and activation of the calcium signaling protein calmodulin, as inhibition of each of these elements prevented both aquaporin-4 relocalization to the cell surface membrane and the increase in water permeability. Downstream of calmodulin activation, hypotonicity also appears to increase CAMP production from adenylyl cyclase, resulting in direct phosphorylation of aquaporin-4 through the cyclic AMP-dependent protein kinase A. We then used microscale thermophoresis to demonstrate that there is a direct interaction between calmodulin and aquaporin-4 as well, and showed that in cells transfected with an aquaporin-4 with a mutant calmodulin binding domain, so aquaporin-4 that can't bind directly to calmodulin, there was a significantly lower membrane relocalization in the cell surface biotinylation assays. It significantly slowed the rate that the aquaporin-4 could relocalize. So we then tested whether molecules that inhibit this aquaporin-4 trafficking in vitro are effective at inhibiting aquaporin-4 relocalization in vivo. We observed that aquaporin-4 appears to be significantly relocalized to the perivascular sites after a traumatic spinal cord injury in rats, and that when they're subject to treatment with a calmodulin or PKA inhibitor, it appears to prevent this effect. We also found that just a single dose of the calmodulin or protein kinase A inhibitor in rats subject to the spinal cord injury, it prevented the onset of edema after spinal cord injury, both acutely and chronically. And furthermore, the calmodulin inhibitor that we've used is an FDA-approved drug called trifluoperazine, which is an antipsychotic and anti-anxiety medication. And its effects there are attributed to antagonism of dopamine D2 receptors and alpha-1 adrenergic receptors. So it's got quite a vast polypharmacology. And so to determine whether the effects that we'd seen in vivo were primarily through inhibition of calmodulin, which we expected, we measured edema following treatment with an alternative calmodulin inhibitor as well as a dopamine D2 receptor antagonist and an alpha-1 receptor antagonist. And it turned out that the other calmodulin inhibitor did also appear to prevent the onset of edema, whereas the dopamine or alpha-1 receptor antagonist did not, so we're confident that it's calmodulin targeting this. So we then assessed whether inhibiting edema after injury affected the spinal cord functionality. So compound action potentials, or CAPs, were recorded across the lesion site to measure the conduction of neuronal signaling following a crush injury, with or without treatment with the inhibitors. So the negative CAP traces across the lesion site appear to be ablated up to 6 weeks post-injury, but not in rats who were subject to treatment with calmodulin or PKA inhibitors. So it seemed to improve electrophysiology across the lesion site at 6 weeks after injury. So we then determined whether this translated into an improvement in sensory or locomotor function, as these are the primary functions that are carried in the dorsal column that was crushed in the injury, as determined by tape sensing and removal and function and horizontal ladder walking tests. For both of these tests, there was significant impairment in the injury groups that persisted as late as 6 weeks, potentially beyond, but we'd measured up to 6 weeks after injury. However, the rats that were treated with inhibitors of calmodulin or protein kinase A, the deficits appeared to almost be normalized by about 2 weeks after injury. So, summary, we believe that targeting subcellular aquaporin-4 relocalization is a viable and novel strategy for developing CNS edema therapies, and we've had a cool little BBC article covering our paper released last week as well, if you want to check that out. Thank you very much.
Amazing, very interesting. So yeah, thank you very much. That was really interesting. So does anyone have any questions they would like to ask? And if you want, you can either type them on the chat or just unmute your mic, and if you want to ask any questions. Anyone? So I will ask a question while people are thinking. So the drug that you mentioned, you said it was so it had lots of different targets, and you've mentioned dopamine. So I was just wondering, what is it being tested or used for anything else? Does it have any other uses that involve the dopamine pathways? Do you know?
Clinically, no. I mean, it's quite an old drug. It's used very sparsely in clinic now, but it used to be used as an anti-schizophrenic drug, so primarily for schizophrenic patients. But due to the side effects and the development of better anti-psychotics, it was sort of just fell out of clinical use.